Our next speaker is Dr. Robert Sege, a senior fellow at the Center for the Study of Social Policy in Washington, D.C., and vice president of the Medical Foundation Division of Boston-based Health Resources in Action. Dr. Sege received his Bachelor of Science degree from Yale, his PhD from MIT, his medical degree from Harvard Medical School, and completed his pediatric residency at Children's Hospital, Boston. Prior to his current positions, he directed the Division of Family and Child Advocacy at Boston Medical Center. Dr. Sege is a member of the American Academy of Pediatrics Committee on Child Abuse and Neglect, the Massachusetts Children's Trust Board, and the Board of Directors of Prevention Child Abuse in America. He received the AAP's 2008 Fellow Achievement Award for his work on youth violence prevention. Dr. Sege is director of the development of the AAP's Connected Kids program for the prevention of youth violence also. He is here today to talk about balancing childhood adversity with resilience, the health effects of positive exposure, hope. Please welcome Dr. Robert Sege.
Thank you so much. And it's such an honor to be here to address the plenary session at the American Academy of Pediatrics. Today I'm going to talk to you about responding to ACEs with hope. I have nothing to disclose, except that I'm indebted to my colleagues Charlene Harper Brown at CSSP, Jennifer Jones in Wisconsin at the Alliance for Strong Families of Children, and Christy Bethel at Johns Hopkins Bloomberg School of Public Health, each of whom shared some of their data that I'll be sharing with you today. I'm so delighted to be here because we are at the dawn of a new era. We now understand through techniques like functional MRI, a number of other techniques, we understand how the human brain develops, what happens, and this power brings to the work we do in pediatrics a far greater understanding than we've ever had before, and the opportunity to provide unprecedented, scientifically based help for children and the families who care for them. Now, these MRI scans show what happens during brain development. When we're born, we have lots of neurons, but it's through life that the connections, the white matter, which you can clearly see developing from 1 week through 3 months, a year, 2 years, 10 years, those connections in the brain are what makes us who we are. In fact, adult brains are far more connection than brain cells. But experience drives the growing brain connections. When an infant is first born, she'll take her first breath. Oxygen goes up, carbon dioxide goes down, and over the course of the first few minutes, then hours, then days, the respiratory patterns get established. Those experiences, like the experiences I'll talk about today, help form the brain. Now, many of you, particularly those who were here at the beginning at the PEDS 21 meeting on Friday, have heard about the Adverse Childhood Experiences Study, or ACEs. What the ACEs study showed is that adverse experiences have lifelong effects. So we know, of course, that having a household member who's in prison, being abused, neglected, physically, sexually, or emotionally during your childhood, having a parent who has a mental health problem, an alcohol problem, or addiction, all of these adverse events have lifelong effects. We also know that there are some adversities that weren't in the original study, which was conducted among a middle-class population in the Pacific Northwest. This little girl is a refugee from wars in the Middle East. She undoubtedly suffered adversity through the disruption, destruction, and death of war. Nevertheless, the ACEs items, there are 10 items: emotional abuse, physical abuse, sexual abuse, emotional neglect, physical neglect, and household items, like losing a parent through divorce or abandonment, witnessing domestic violence, having a household member who struggles with alcohol or drug abuse, having a household member with a mental illness or someone who attempted suicide, or having a household member imprisoned. The way the ACEs study works, each of those events that a person recalls from childhood provides an increment of 1. The higher the ACEs score, the more likely adverse health outcomes are. There are a lot of these outcomes. Alcoholism and alcohol abuse, chronic obstructive pulmonary disease, depression, fetal death, health and quality of life, illicit drug use, ischemic heart disease, liver disease, risk from partner violence, sexual transmitted diseases, smoking, suicide attempts, unintended pregnancies, adolescent pregnancy, and quite a few others. All of these things, adult health problems, are very important individually to each of us. They're also very important to the economy. The Center for Disease Control estimated, for example, that only the substantiated child maltreatment from 2009, 1 year, results in $124 billion in lifelong medical costs and over $500 billion in lifelong overall societal costs. Now, earlier I told you we're going to link this to brain development, and Jack Schoenkoff and his colleagues at the Harvard Center for the Developing Child have helped provide the pathway that links these childhood adversities to these adult health outcomes. So we all experience positive stress. Positive stress is moderate or brief. For example, standing behind the stage, wondering what it's going to be like to be in front of this audience. Tolerable stress, more severe, but can be buffered through adaptive behavior or support. A common example during childhood would be death of a pet. The toxic stress, severe, chronic, unbuffered by supportive relationships, causes changes in the hypothalamic pituitary axes and undoubtedly other inflammatory reactions, and that's what links these adverse childhood experiences to poor health. Okay, so everyone depressed now? Think about the storm clouds that have gathered, but all of us as pediatricians know that there's more to it than just adversity. So before I continue my talk, I want each of you to take just a moment and hold in your mind someone you know, an adult who's functional, maybe even someone who inspires you or is admirable, who had childhood adversity but has somehow gone through it. And I'll give you just a moment to hold that person in mind. For the rest of the talk, we're not going to ignore those storm clouds, but we're also going to think about the positive experiences, the other things that happen that enable us to bounce back, be resilient, and become the functional adults that we want to be and that our parents want for their children. I think of this as a spectrum of experience. At one end, there are those adverse experiences which interfere with normal child development. Then there are many other experiences, like the breath I told you about, which are important. And then there are positive experiences that have significant advantage for child development, that allow children to develop normally and allow them to bounce back from adversity. So going back to this slide, I told you before that experience drives growing brain connection. We talked about those adverse experiences. Now I want to talk about those positive experiences. And I'm doing that because I want to leave you with hope. And hope, of course, stands for health outcomes from positive experiences, equally as important as the negative health effects of adverse experiences. So as you hold that person in your mind, think about, did they experience attachment as an infant, the learning of unconditional love that goes on in the first year of life? Did their parents talk to them or read to them? That back and forth with words, reading to children, improves cognitive development, so kids enter kindergarten with larger vocabularies and ready to learn. Did they have an opportunity to play? And as you can see, this little child on his balance bike is not only learning a physical activity, he's interacting with another child, and he's in a safe environment that allows him to explore. We need to make sure that children have an opportunity to play, and I'm proud to say that the American Academy of Pediatrics has a policy statement describing the importance of play for child development, something we often forget about in our overstressed lives. When a person's an adolescent, and probably everyone in this room can recall an adult other than the mother and father who cared about them, took an interest in their lives, provided some direction. Big brothers and big sisters and other mentoring programs help fill that gap to make sure that every adolescent has 2 or more adults other than their mother or father who take an interest in them. These have strong effects on the social, emotional, and cognitive development of teenagers. What I hope I've convinced you of at this point is that it's not just a question of is the glass empty or half empty or half full, but positive experiences are qualitatively different than adverse experiences. And while we work to minimize adversity, we also need to work to improve the chances of children experiencing those positive experiences that allow normal child development and the development of resilience. This is a new concept, and my colleagues and I have a research agenda. We're conducting a literature review. We're evaluating existing survey data, and we're collecting new data. Allow me to share just a little bit of that with you. Together with Charlene Harper-Brown, we've conducted a literature review that's now in press at the American Journal of Public Health. And we found 4 general categories of positive experiences that have a strong research base of supporting adult health outcomes. First is being in nurturing relationships. I talked to you already about attachment. We also know that peer relationships are extremely important, the social environment that children end up in, school age in particular. And as I mentioned earlier, mentoring relationships, relationships with an adult other than your mother or father who takes an interest in the growing person's life. Children need to live, develop, and play in safe and stable environments. And these environments lead to high quality, these environments include things like high quality learning environments, homes that are free of mold, free of lead, homes that are actually exist, the children aren't homeless. All of those things that we talk about when we talk about social determinants of health, that's what it's about. Children need a safe place to play, need a high quality learning environment, and they need a stable home. Children need opportunities for social engagement and connectedness, something we don't think about enough as pediatricians. When children are able to feel that sense of connectedness, they feel loved and valued, and we know that that decreases vulnerability, increases resistance, and decreases the likelihood of negative outcomes. So it's great to be a pediatrician and talk about this, but this has been known for thousands of years. Communities, faith-based communities, neighborhoods, all of those organizations understand the importance of opportunities for children for social engagement and connectedness in space and time. Children need the opportunity to learn social and emotional competence. They need to be able to identify, understanding, and express their own feelings. They also need to understand the emotional state of others. They need to be able to manage challenging experiences. One way to think about this is think about a child who plays in sports. So I'm in Boston. We have a guy named David Ortiz. He hits a couple home runs every so often. Most of the time he comes to the plate, he gets an out. He fails. Children need to learn that they can fail but succeed, and that persistence, the practice, all of those things. So it's not just the good stuff like teamwork, it's also the experience of being knocked down and getting back up for another day. Children can learn that. The more one has the experience of resilience, the more resilient one might be in the future. The CDC, their Essentials for Childhood program, is working on a state-by-state basis around the United States to develop policies that will help create safe, stable, nurturing relationships and environments. And the CDC has identified these qualities as what we need to prevent child maltreatment. And as we've seen, these are the same qualities that we need to promote the optimal development of all of our children. Earlier in this meeting, there's been much conversation about ACEs. Christy Bethel at Johns Hopkins has just released the National Survey of Child Health data. And I want to show you this one slide from her work that shows among children who've experienced adversity, if they also have high resilience scores, they are less likely to repeat a grade in school and more likely to be engaged at school. And all of us as pediatricians know that school is a functional outcome and probably the best functional marker for childhood. So we know that anything that we can do to help children develop their own resilience will help them even if they experience adversity, which obviously we'd rather than not do. We're currently collecting new data to understand the epidemiology of hope, health outcomes of positive experiences. How well do adults recall their own positive experiences? What is the prevalence of key positive childhood experiences? How would hope and ACEs score interact in our long-term health effects? And is there a dose of positive experiences? Does that dose matter? Currently in Wisconsin, we're working with the Behavioral Risk Factors Surveillance System. BRFIS, as it's lovingly called, is a CDC-directed telephone survey conducted in all 50 states that measures health-related risk behaviors over 400,000 telephone interviews each year. The states can add questions, and in Wisconsin, led by Jennifer Jones, we've now introduced 6 items about positive experiences. 3 experiences related to the adult's recollection of themselves and their families, and 3 items related to positive experiences in the community that the children may recall. And I want to note that one of those questions that comes from the WHO is something to the effect of, do you recall taking joy in your community's cultural traditions? And what a beautiful way to begin to ask about some of the things that we get that are positive that may negate some of the effects of racism and other issues that all too many children suffer from. Just to bring this point home, I want to bring you back to this child I showed you, this young refugee. One of her stories is a story of adversity, that her home was destroyed, she had to flee her country. A second story might be the story of her family. Her family protected her and rescued her. Even in the refugee camp, she played tag with her little brothers, with her big brothers, and her sisters watched out for her, all under the watchful eyes of their parents and other adults. A third story that this young person might have is when they finally arrived in a country of refuge, people lined the streets to welcome them, and a stranger handed her a teddy bear. Individual adversity, family providing buffering, a community responding to it. 3 stories for one person, and think about the likely health effects and how she might recall her life when she gets older. If you think about that, I think you'll understand exactly what I'm talking about with hope. Now, I want you to go back to the person who I asked you to hold in mind. I've gone through a number of positive experiences and kinds of positive experiences, and I hope that this helped you understand that person, what happened, what might have happened that allowed him or her to survive that childhood adversity and become a functional adult. Bright Futures gives us direction for doing this ourselves. In Bright Futures, we're encouraged to ask about child and family strengths. What are you most proud of about your child? To ask about connection with the community. Who helps you with your child? And finally, to begin to think about play. What do you do for fun? Asking all of these questions begins to allow us to integrate promotion of positive experiences into our work. In closing, a lot of what I've talked about is really footprints we've all seen in the sand, well-trodden territory. Most of us who are in practice understand the joys that families take watching their children grow up. I hope that with today's talk, we're able to do a better job of balancing our promotion of positive experiences with our understanding of a traumatic experience that may make it more difficult. And thank you very much for your attention.